Hey, I'm Dr. Michael Major, and as we continue our conversation about pediatric sleep apnea, sleep disordered breathing, there's two different craniofacial patterns, two different shapes of the face, the types of malocclusions that we tend to see that can tell us something different about what's going on with the kid, what their treatment options are going to be, what their prognosis is going to be, and what potential sites of obstruction might exist. The first is really when we have the children who have long faces. We're talking to kids who've got a long face like mine, especially with the chin kind of pointed out, the constricted maxilla, the tendency towards an anterior open bite with the front teeth. These are the kids that usually have problems breathing through their nose. They're the children who have chronic allergic rhinitis, they have large adenoids, that there's something that's happening inside of the nasal passage. The tongue can't sit properly to the roof of the mouth, and it changes the function and then the direction of growth of the face. These children tend to benefit really well, and there's some good orthodontic interventions. They also should likely be seen by a pediatric ENT at this point in time. But before you make any of those referrals, always stop and run through your PSQ and your relevant medical history to make sure that you're triaging and sending the patients in the right direction, because the same long faces can also be a risk for having early signs of things like degenerative joint disease. So be careful that if you don't just see something, you right away jump to a conclusion, that you go through your proper testing sequence so that we can triage and figure out where these kids will need to be seen properly, be properly taken care of. My name is Dr. Michael Major, and I hope everything's going well for you. If you have a question about a patient, feel free to shoot me an email at mpmajor@ualberta.ca. Have a wonderful day, and I'll see you again soon.